with the rest of the country immediately. When it comes to hospital beds, again, the goal is to take the 20,000 or so we started with the month of March with the normal complement of hospital beds in this city that were staffed with professionals all over our hospital system. Those 20,000 are increasingly going to become all ICU beds over the month of April. That's what our hospitals will be for more and more, taking on the toughest COVID cases at the front line. We need to build out during the month of April an amazing number of additional hotel beds, I said hospital beds, I should say, my apology, hospital beds. And hotels will be one of the ways that we achieve that. But hospital beds, we need to build out an additional number of 65,000 hospital beds in the city of New York by the end of April. We already have a tremendous start. The 20,000 beds, as I say, they were already there. Hospitals are now adding up to 50% more capacity, just drawing on all the space they have. And Dr. Katz talked about this from the beginning, the ability of hospitals to quickly build out more beds, more space, more ICUs. That number will add an additional almost 10,000 beds right there. Javits Center, we've talked about, and Dr. Katz will go over this, thousands of beds there, and then all the hotels will bring online increasingly. So this is going to be an epic process through the month of April to build out that capacity. But this goal is within reach. It's going to take Herculean effort, but I'm confident it can be reached. So now, as I turn to Dr. Katz, we're going to talk about where we are today on our hospital capacity, the building out process, starting with our public hospital system. This growth pattern, this building out I'm talking about is literally going on 24/7, and a profound thanks to everyone who's participating in it. So Dr. Katz is going to give you a sense of where we stand today and how we're going to be moving forward over the coming weeks. Dr. Mitch Katz.
Thank you so much, Mr. Mayor, and thank you for supporting the public hospital system. It's clear in this emergency how lucky we are that New York City kept open its public hospital systems, didn't allow them to close the way it happened in Philadelphia, in Washington, D.C., in Milwaukee, because in this crisis we so desperately need the public system. We have 324 ICU beds that we run under normal circumstances, and a total of 4,428 beds. And while those are very large numbers, they pale in comparison, Mr. Mayor, to what you showed us we're actually going to need in this crisis. But we are prepared to meet the crisis. In our immediate surge to handle it, Elmhurst Hospital, which is on the forefront of handling COVID patients, it's in an area of central Queens where a large number of districts depend on this hospital because there is no other hospital near it. It has already increased from 29 intensive care beds to 111 intensive care beds, and so that's in the matter of 10 days. I mean, these are changes that you would expect under normal circumstances would take 6 months to a year to get the beds in place, to get the staff in place, to get the equipment in place. Every single one of these beds represents a courageous nurse taking care of the patients, courageous physicians, and all of the support. Intensive care patients need a great deal of support from pharmacy, from transport, from radiology. It's a tremendous effort to take care of each intensive care unit patients, and yet Elmhurst has magically gone from 29 to 111 beds. At Lincoln Hospital, they've grown their ICU from 34 beds to 114 beds, with 30 more coming there. And Bellevue Hospital has grown from 66 to 127, with 52 more coming. And this is really just the beginning of what we need in order to handle this emergency. We have, in order to deal with the fact that COVID-19 patients have not appeared evenly across our system as the epidemic hits different parts of our city at different moments. Also, we recognize that some areas of our city, like Queens, have markedly fewer hospitals. So it's not just Elmhurst Hospital, but Queens Hospital that has also been hit extremely hard by patients and very sick patients. So in order to be able to do this, we have transferred 193 non-ICU patients and 43 ICU patients from the hospitals that have been most affected and moving them to hospitals where we've had greater capacity in the last few weeks. So we've been moving patients to Coney Island Hospital, to Jacoby, to Harlem, to Metropolitan, and the North Central Bronx have all taken patients in order to make sure that we are able to provide care for every patient who needs it. Every hospital, and I speak to them every night, knows exactly what space they're next going to open during the night. We've seen a large number of patients needing intubation come in the evening hours. So we open the units often in the middle of the night in order to accommodate them. But in every case, we know what those surge wards will be. It fits with the very plans that we started working on in January and February when we first saw the data coming from China. We recognize, Mr. Mayor, that while these are huge efforts, they won't meet the needs as you've outlined them to New Yorkers. So in the short term, we're going to bring on an additional 762 intensive care beds for a total additional beds of 2,466. And again, while these numbers are astronomical, they don't add up to the numbers that you showed New Yorkers of what's going to be needed. We intend to convert all of the hospitals into intensive care units because an intensive care patient relies tremendously on the ability of the laboratory, on the pharmacy, on equipment, radiology. You cannot create an intensive care unit, a bed, in a hotel. But what we can do is turn our facilities into large intensive care units and then use the hotels and the other alternative facilities for medicine patients who do need support but don't need the same level with ICU need. This is going to require huge influx of equipment and even more importantly of staffing. The issue is not one of spacing, and we've said this right from the beginning. There are many places in New York City that would be available to create additional space. The challenge is having the staff, having the equipment, and in the case of intensive care units, having all of the other services that would be necessary in order to keep people alive. So it's our commitment to you, Mr. Mayor, that we are going to do everything working with you and all of the great people in New York City to achieve this. In order to reach just what we've done so far, we've added 165 physicians, nurse practitioners, physician's assistants to the system. We deployed 1,000 registered nurses. We have another 1,000 registered nurses coming within 2 weeks, and we've added another 350 physicians, nurse practitioners, and physician assistants that will be coming in the next week. But this will still, again, not be sufficient. We will need a great deal more staff than this to be able to successfully increase by the number of intensive care beds that New York City is going to need. We are doing everything possible to support the incredibly brave nurses and physicians and support staff of every kind who are working long hours, often watching their own coworkers become ill. It creates a tremendous sense of distress to both be working hard and know that coworkers have gotten sick, but people are bravely working on. We want to do everything possible that we can to support them. We're making sure that there is COVID-19 testing available free for any of our frontline personnel. That's starting at our occupational health clinics. We've received more than $1.6 million in donations to provide comfort items to our frontline staff. They can't take any breaks to go out to get food. That's not even in our rule book about how you get through these kinds of crises. So having people give us donations so that we basically can bring in food for all the shifts of workers. People do need to eat, and we are very grateful. The rooms in the hotels, many people